get very cold, they can go into what we call the cold stress, which will then cause them to use up a lot of their energy. So we're always trying to protect them from getting cold. These are the 4 ways that babies can lose body heat. Okay, the first one is radiation, okay, which is the transfer of heat from the baby to cooler objects that are around the baby but not in touch with them, with their skin. So it's transfer of heat from the baby to cooler objects that are not directly in contact with the baby's skin. Okay, that's radiation. And to prevent heat lost through radiation, we want to make sure that we immediately place the baby under the radiant warmer if they're going to need resuscitation. Okay? Remember the initial steps of resuscitation. If the baby comes out doing fine, the baby can stay with the mother. But if not, immediately we're going to place the baby under the radiant warmer. Okay? And begin the initial steps of resuscitation. They can also lose body heat through conduction. And that is the transfer of heat from the baby to cooler objects that are directly in contact with the baby's skin. So you want to make sure that the blanket that you're going to put the baby down on will be warm. It will be a warm blanket. If you're going to dry them up, you're going to use a warm towel to do it. So that will prevent the heat loss through conduction. And then they can also lose body heat through convection. Convection is like losing body heat to cold air. Okay, you lose body heat to cold air. So what we have to do in most cases to prevent that is to avoid people moving around the baby a lot. Because anytime you move across the baby, the cold air coming from you will go to them. Okay? They call that the cold draft. So minimize movement around the baby to avoid that. And then they can also lose body heat through evaporation. We want to make sure that the baby is dried up if it comes out, okay? Because if they're wet, okay, that's going to make them feel cold and then begin to produce heat, okay? Because they're cold and then they're losing their body heat. Again, loss of body heat, cold stress, loss of body heat, hypothermia, can result in babies developing cold stress. The initial response of the baby is peripheral vasoconstriction. The blood vessels in the peripheral will constrict, which eventually leads to anaerobic metabolism and metabolic acidosis. So it's like there is blood flow, okay, from the periphery, okay, will decrease. And the tissues then will not have adequate oxygen for metabolism. So they go into anaerobic metabolism, which is metabolism without oxygen. That usually results in lactic acidosis, which causes metabolic acidosis. So one thing I need to tell you that is relevant to that is that anytime a baby has metabolic acidosis, anytime they have metabolic acidosis, you would tend to increase their PaO2, not giving them back up. Okay? If a baby has metabolic acidosis, usually look at their PaO2. If it is low, you give them oxygen first. Because, low level of oxygen causes them to go into anaerobic metabolism, which causes a lactic acidosis that causes metabolic acidosis. Okay? Remember that. Think about oxygen before you think about bicarb for babies if they have metabolic acidosis. Hypothermia also triggers non-shivering thermogenesis. The way we undergo metabolism, adults undergo metabolism, is by metabolizing glucose, okay, in the cells. So that's not what babies, use. Okay, babies make a brown fat in utero. Brown fat. So babies don't usually, like when you get very cold, you shiver like that. That's adults. Babies don't do that, to generate body heat. What they do is they metabolize the brown fat that they made in utero. Okay, so they try to conserve that brown fat until months away after birth. So before they switch to the way that we do it. So we're always trying to make sure that they don't use it up, okay, before they get to the point where they will start generating body heat like us, okay? So that's why we need to be protecting them from getting cold, because anytime they get cold, they undergo that non-shivering thermogenesis to produce body heat by metabolizing the brown fat, okay? Any questions? Non-shivering metabolism and peripheral vasoconstriction temporarily generates body heat for the baby. Continued hypothermic condition can deplete the baby's energy source, eventually leading to death. If they can make body heat, then they're going to die. Now, what I call this personally is hot stress. This is when the baby is hot. Okay? What happens to the baby when the baby's body temperature is higher than normal, which is hypothermia. Okay? What's going to happen is that baby initially responds by vasodilation of the peripheral vessels to dissipate heat. They open up their blood vessels, okay, in the periphery, and heat can escape through it. Okay? And then when the heat is going away, they will be making more heat. Okay? Because now they will be cool as the heat is dissipating. Okay? And then they're still using the brown fat. Okay? So it's like they can't be too cold and then they can't be too hot either. So either way is a big problem for them. Now this is the Iranian woman. Now if your wife has not had a baby and then you have the opportunity to see this is what it looks like. The first time I saw it was when my wife had the first baby. I'm like, oh, what in the world is that? That's a very nice bed. I wish I can have one of these for winter, Just kind of crawl in there and you'll be all warm and stuff. So that's what it looks like, okay? So once they hand you the baby, you just take it in there and then start wiping it down and simulating the baby. All right. On the other side is the incubator. The incubator, like I said, it provides a controlled temperature environment for the baby. Okay. They use it a lot in the NICU. They use it for transport. Okay. Move the baby from one hospital to another, or from one unit to another. The only caveat about this is that the baby tend to lose oxygen a lot, because anytime they open the door to attend to the baby, like if the baby is in there, the nurses always will open the door to attend to the baby, and if there's any oxygen that is soothing there for the baby to receive. Once they open the door, the concentration of the oxygen decreases. So babies can get very, very hypoxic, okay, if they're having problems. That's the only downfall with this. Otherwise, it's pretty good. So the next thing is neonatal jaundice. Now, jaundice is the yellowish orange skin coloration that accompanies increased bilirubin. Okay, so the baby's skin is yellow. Okay, bilirubin is the breakdown is formed as a result of breakdown of red blood cells. Okay, so it's like the more red blood cells that you have breaking down, the more bilirubin that you're going to have. Okay, and the more skin discoloration that the baby is going to have. Bilirubin is processed by the liver. Okay, so initially, bilirubin is, it's got some fat in it. It's fat soluble. Fat soluble. Bilirubin is fat soluble. So, it is transported to the liver. And then the liver will conjugate the bilirubin. So basically what conjugation means is that the liver is going to process it and it becomes water soluble instead of fat soluble. It becomes water soluble before it's removed from the body. Okay? So conjugated bilirubin means that it has now been made water soluble. Unconjugated bilirubin means that it still has fat in it. So if you look at bilirubin profile for a patient, you're going to see where they put conjugated bilirubin and unconjugated bilirubin. So unconjugated bilirubin is more dangerous. It's very dangerous because it's fat soluble. Okay? Any questions?
Yes. Is it a problem with the liver then?
Yeah, it can be a problem with the liver. Maybe the liver, something's wrong with the liver is not processing it well.
Causes the destruction of the red blood cells?
Yeah, maybe too much red blood cells are dying. Okay, I think I have them all written out. I'll show you in a minute. Okay. Yeah, that's why we use it to measure the function of the liver. Okay, so if you have a lot of unconjugated bilirubin, then your liver function is not good. Okay, your liver function is not good. So causes of jaundice. Neonatal erythrocytes have shorter lifespan. Okay, their red blood cells tend to live shorter. Okay, they die quicker than ours. As a result of that, they break down and form that bilirubin. Neonatal liver cannot conjugate excess bilirubin. Okay, their liver is not very, very mature like that of the adult. Okay, so for some reason, their red blood cells are dying, okay, at a very massive rate. Then their liver cannot handle that. Okay. Hemolytic disease of the newborn. Remember, I told you about that. You know, like everybody has a strand of protein in their red blood cell, on their red blood cell. If you have it, then you are Rh positive. If you don't have that strand of protein, you are Rh negative, blood type in here. So if a mother becomes pregnant with a baby that is Rh positive, but the mother is Rh negative, the mother is going to develop antibodies, because that, protein, okay, on the surface of the baby's red blood cells is antigen. So the mother responds by making antibodies. So the first pregnancy is not a problem, but in the next pregnancy, if the mother gets pregnant again with a baby that is Rh positive, then those antibodies that the mother made in the previous pregnancy will cross over to the placenta and attacks the baby's red blood cells, okay, and try to kill it. So that will result in a lot of bilirubin. So anytime a baby is very jaundiced, you may suspect that they may be having hemolytic disease of the nipple. Okay? And that disease is also called erythroblastosis. Erythroblastosis in cows. Okay? If the baby is bleeding, okay, that will cause a lot of red blood cells to go out and die. Impaired liver function, the liver is what processes the bilirubin, is what conjugates the bilirubin. So in the presence of a lot of unconjugated bilirubin, we can infer that the patient's liver is not working appropriately. Biliary atresia. Well, atresia means obstruction. Okay? Obstruction. Bile is, let me see if I can remember that. Bile is like a digestive fluid that is produced in the liver. It's a digestive fluid that is produced in the liver and then transported to the gallbladder. It's in the gallbladder. Okay? So what it does is to have a digestion. So if that happens, if there is obstruction to the pathway that the bile goes from the liver to the gallbladder, that can cause a lot of red blood cells to die too. Okay, and then the baby can get jaundiced. Any questions about that?
So again, I'm sorry, it's digestive fluid.
It's a digestive fluid that is produced in the liver and then transported to the gallbladder to be stored. Okay? So that pathway through which the bile goes from the liver to the gallbladder to be stored, if it is blocked, okay, then we have problem. Okay? Biliary atresia. Complications and treatment of that high bilirubin. Okay? It can cause, I didn't say that word well, connectivirus. Okay? Now, connectivirus is like when the fast-soluble bilirubin enters the brain. Okay? If it enters the brain, you have it in your brain. It can cause brain damage. Okay, if unconjugated bilirubin is very high, it can actually cause brain damage in the baby. And that is called connectivirus. Yeah, how would you pronounce that? You know, I've been teaching this for how many years? 15 years, but I still haven't really learned how to pronounce it. Connectivirus. Okay. All right, so that connectivirus, all it is the fast soluble bilirubin getting inside the brain and causing brain damage. Okay. So it can also cause, of course, anything goes wrong with your brain, you will have neurological deficits. Okay. You can have cerebral palsy, hearing impairment, and sometimes intellectual disabilities. Okay. So unconjugated bilirubin is bad. How do we treat high bilirubin, especially if the baby gets jaundiced? Well, there are a few ways that you can treat that. We have what we will call the phototherapy. Now, usually they bring the baby out to the sun, okay, in the sun, and the sun will help break up the bilirubin to water-soluble bilirubin. They have the blue spectrum light works better. Okay, but I know that, that's one of the things that mothers are usually told when their baby have jaundiced skin. They bring them out to the sun. Okay, so that's what the sun does. It breaks it down to water soluble so that it can be removed through the kidneys. And then they have what they call the exchange transfusion. Exchange transfusion. So in the exchange transfusion, basically what they're doing is dilution therapy. So what they do is they draw maybe 20 cc of blood from the baby, and then they put back in the baby fresh blood, 20 milliliter. And then they draw out 20 milliliter from the baby, and then they put in fresh blood, 20 milliliter. So with that process, they are diluting the level of bilirubin. So that's what they call the exchange therapy. And then phenobarbital can also reduce bilirubin. Now, phenobarbital is actually a medication that is used for convulsion. Okay, it is a benzodiazepine. Okay, it's good for convulsion and for sedation as well. It's a very strong sedative. Okay, but it is able to reduce bilirubin. Okay, and then albumin is blood protein. Albumin is blood protein. Okay, the albumin helps to transport the bilirubin out of the body. Okay, it's blood protein. We give them albumin. Necrotizing enterocolitis, NEC. NEC is a neonatal disease characterized with necrosis of the intestine. Okay? NEC can cause abdominal distension and even death in babies. Causes when they have mucosal injury. It's an injury to their intestines somehow. Bacterial invasion. Bacteria in their intestines. Formation of gas in the intestines as well can cause that. Okay. Clinical signs and treatment. How do we know that they have NEC, necrotizing enterocolitis? The baby is going to have Geiger positive stool. So this is like a lab test in which that they use to see if there is blood in the baby's stool. Okay? Whether there is blood in the baby's stool with a lab test. So now if the baby has NEC, then they're going to have Geiger positive stool. There will be blood in the stool. They may have abdominal distension. Okay, their stomach swell up a little bit. If it's a boy, it looks like he's pregnant, but he's not. I've seen a lot of that in Africa. No, I'm not kidding. Not until I started teaching this did I know, oh, okay, I see why some people look like that, some babies look that way. Poor tolerance of feeding. Okay, the baby will not feed well. Okay, because their stomach is already filled up with stuff. They don't feed well. Bowel tinted emesis. Okay, when they spit out, it's green in color. The bowel is green in color. It's tinted. They're going to have lethargy and increase their FiO2 requirement. Yeah, it's infection there. That causes the baby to want to use up more oxygen. Treatment for that. Prevention of causative factors. Good hand washing when treating patients. You're going to stop oral feeding and begin nasotracheal suctioning. You're going to give them antibiotics for infection there in the intestines. give them high FiO2 to raise their PaO2, oxygenate the tissues. And then nitric oxide. Nitric oxide is a vasodilator. It increases the flow of oxygenated blood to the intestine. Any questions